हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के सम इम्पॉर्टेंट एमसीक्यू। विच अमंग द फॉलोइंग इज द मोस्ट लाइफ थ्रेटनिंग मैनिफेस्टेशन ऑफ CKD? डिक्रीज GFR, increased creatinine, hyperkalemia and proteinuria. The best answer here is the hyperkalemia, because the hyperkalemia, according to the given the option, is the most life threatening complication of chronic kidney disease, as it can result in cardiac arrhythmias and sudden death. CKD is the stage based on decline glomerular filtration rate and albuminuria. The various clinical manifestations occur due to loss of kidney function and accumulation of various uremic toxin, urea, creatinine, and other products of protein metabolism. Complications of declining kidney function include volume overload, volume overload, hyperkalemia, and metabolic acidosis, hyperphosphatemia, hypertension, anemia, and dyslipidemia. Next question. A patient presented with massive abdominal swelling. Paracentesis fluid was sent for lab analysis and results show serum protein to 3 gram per dl and ascitic fluid protein to 1 gram. What is the likely diagnosis? Congestive heart failure, early Budd-Chiari syndrome, late Budd-Chiari syndrome, and tuberculosis. The best answer is the late Budd-Chiari syndrome, because the likely diagnosis is the given serum ascites albumin gradient कितना है 1.1 gram per dl, calculated as serum albumin level ascites fluid albumin level, which is in the case of 3 to 1 2 gram per dl, and ascites fluid protein कितना होता है 2.5 ग्राम पर डीएल. तो इसको क्या बोलेंगे हम? लेट बड-कैराई सिंड्रोम. Serum ascites albumin gradient can be used to differentiate between ascites due to portal hypertension and non-portal hypertensive ascites. It represents the pressure with the hepatic sinusoids and correlate with the hepatic venous pressure gradient. Arthritis is seen in all except SLE, Beckett disease, ulcerative colitis, rheumatoid arthritis. Best answer is the rheumatoid arthritis, because the here in arthritis is seen all about the condition except rheumatoid arthritis. Arthritis is a arteriocyclitis, is also known as what? Anterior uveitis. Anterior uveitis is seen in ankylosis spondylitis, psoriasis, reactive arthritis, leprosy, systematic lupus erythematosus, juvenile rheumatoid arthritis, and posterior uveitis seen in Vogt-Koensenge-Harada syndrome, cat scratch disease, Whipple disease, and brucellosis. Both anterior and posterior uveitis seen in sarcoidosis. Both upper and anterior and posterior uveitis seen in sarcoidosis, Beckett disease, inflammatory bowel disease, herpes infection, syphilis, Lyme disease, TB, onchoriasis, and intermediate uveitis or pars planitis seen in multiple sclerosis. An 18-year-old girl with the diagnosis of acute promyelotic leukemia was treated medically. She developed fever and tachypnea, and chest X-ray showed pulmonary infiltrate. What drug should be given next? Citrabine, dexamethasone, doxorubicin, and methotrexate. The best answer is dexamethasone, because here the clinical scenario describe the patient with APL, acute promyelotic leukemia, developing what? Fever, tachypnea, pulmonary infiltrate. While on medical treatment, this is suggestive of APL differentiation syndrome, an adverse effect of all trans-retinoic acid. The management involves glucocorticoids like dexamethasone. Along with the glucocorticoids, the other management also present. APL differentiating syndrome includes chemotherapy and cytoreduction and supportive measures in severe cases. Temporary discontinuation of ATRA is necessary. ATRA is an oral drug that induces a differentiation of leukemic cells bearing the T15 to 17 chromosomal translocation. And in the while TRA reduces the incidence of DSA associated with the citrabine and daunorubicin used earlier in APL, it can cause APL differentiation syndrome due to the adhesion of the differentiation neoplastic cell to the pulmonary vasculature endothelium. Next question: the definition of fever of unknown origin includes all of the following except undiagnosed after 1 week of investigation. This one is the answer, because the current definition of fever of unknown origin does not include undiagnosed after 1 week of investigation. The criterion diagnosis uncertain after 1 week of evaluation, which was previously a part of the definition, has been removed. So today that's all, and thank you and keep revise.